Good afternoon, everyone. Welcome to Yashoda Hospitals webinar series. Today we take on topic on inhalation therapy and inhalation delivery devices. The pulmonary route of administration has proven to be effective in local and systemic delivery of drugs. Currently, inhalation therapy is the best option for lung diseases like asthma, systemic fibrosis, and chronic obstructive pulmonary diseases. The local therapies allows the use of smaller doses and reduces the systemic side effect. Inhalation therapy is effective in most of the cases due to fast absorption by the massive surface area of alveolar region and vasculature. I am Dr. Amar Biradar, Associate Vice President, Yashoda Hospitals. I welcome for today's webinar as expert panelists, Ms. Sija Sanjay, GM Nursing, Yashoda Hospital, Secunderabad, having total experience of more than 12 years. I welcome Ms. Yojana, today's speaker. She is having more than 12 years of experience in education department, working with us since long time. Ms. Yojana, please start the webinar and please go through us completely and read this. Yojana?
One moment, sir. We can continue the briefing.
I think there is some technical glitch.
Yeah.
So this inhalation therapy and delivery device is what we are talking today. Most of the nursing services, it could be patient, and everywhere it is commonly used devices. These are, and it is like user friendly. It can be used at the home. It can be used in the hospital setup, as well as it is used in the pediatric cases, adult and geriatric cases. So mostly it is seen in the more respiratory diseases like asthma and the pediatric cases, seen mostly into the COPD cases, into elderly patients, and where there is like more polygrams are there. I think Yojana is connected now. Can you hear me, Yojana?
Yes, sir.
Okay.
Let's start the session.
Webinar, please. Yeah.
Thank you, sir. Good afternoon, everyone. Save environment and saves life, because breath matters a lot. So many people all over India and worldwide, they are facing many respiratory issues. And according to NCBI, so 545 million people are suffering with respiratory disorders. And inhalation therapy is one of the devices where it can be treated. So in this session, I'm going to explain about what is inhalation therapy, why we need an inhalation therapy, what are the various methods of inhalation devices, difference between different devices, do's and don'ts of inhalation therapy. Let's see what an inhalation therapy. It is any drug or solution that is administered through oral or through the nasal so that it travels to the respiratory tract and distribute the alveoli so that the respiratory condition can be treated. And so why a patient requires an inhalation therapy? So when you see a respiratory system, so here, when there is a normal inspiration and expiration, you will take oxygen and it will distribute to the alveoli, and this exchange of, as soon as it receives the oxygen, it will be supplied to the tissues and to the circulatory system. And next, if at all, if a patient is having any respiratory disorders like maybe bronchiectasis, asthma, chronic COPD, so because of this, so maybe a bronchus will be closed or the secretions are obstructing the flow of oxygen to this. And what happens when you give an inhalation to the patient? So it will travel when you're giving through the oral route or through the nasal route, it will goes into the lungs directly and it will supply to the lungs. And whereas when it is supplying to the alveoli, so the tissues will be getting the oxygen and it can be delivered properly, and the underlying cause can be treated because of this inhalation therapy. Next, so there are various methods to deliver inhalation therapy. The one is the nebulization, inhaler, and spacer. Through nebulization, we have two more devices. Like we can give nebulization through nebulizer and aerogen. So these are the two devices. According to the patient condition and the requirement, we can choose either nebulizer or aerogen for this inhalation therapy. The next is inhaler. We have many devices that a patient can be used, but out of all these things, the mechanism, the four we have selected, that is metered dose inhaler, dry powder inhaler, rotahaler, and spin inhaler. Then coming to the third one is a spacer. So we'll see one by one in the next slides. The first is the nebulization. What is nebulization? Can anyone answer me? What is a nebulization? You can chat in the comment section, so your answers can be noted here. So what is nebulization? So coming to the nebulization, it is the liquid. So when there is a liquid, that will be converted into vapors and it is supplied to the lungs. So it is a different method where it takes 15 to 20 minutes for the patient to have a action to be completed. So we have a different drugs that are administered either for the nebulization or for the inhaler or the spacer. The first one is an anti-allergic drug. For example, it is a budesonide. So actually this budesonide is a corticosteroid which helps in relieving the inflammation in the lungs. That means, so when this drug has administered to the patient, this will travel and the next whatever the inflammation is there, so it will help in relieving the inflammation so that the patient can have an easy breath. Then coming to the bronchodilators. For example, it is a salbutamol. So salbutamol is a bronchodilator. So why we are using a salbutamol? So when a patient is having a bronchitis. So when a patient is having a bronchodilators, so here the bronchus, if there is an inflammation, so what happens if this is the bronchi or the bronchi? So this is a normal airway. So when there is any inflammation, so what happens? This bronchus will keep on constricted like this. So when you give this drug for the patient, so it will help in opening the bronchus so that the air can travel into the bronchus so that the patient will have a good oxygenation. And mostly these bronchodilators can be used for the patients who are having COPD, asthma, and bronchitis, bronchiectasis. So these are the common conditions where we can treat the patient with salbutamol. The next is the mucolytic agents. So mucolytic agent, for example, histamine and mistobron. So these drugs, so what happens here? So when a patient is having any upper respiratory infections or the lower respiratory tract infection, there is a chance of mucus accumulation in the bronchi and also in the upper respiratory tract. So when there is a mucus, severe mucus, so this mucus is obstructing the airway so that whatever the oxygen we are taking, it is not able to oxygenate. That's why. So these mucolytic agents will help in loosening the secretion so that there will whatever the secretions are there, it will come out and it will help in ease of breathing. The last one is the antibiotics, that is antimicrobial. For example, colistin. So mostly we are preferring to use colistin as an antibiotic for some conditions. Why? Because, so for example, patient has admitted in ICU. So now in the ICU, maybe because of severe disorders or because of some unhygienic or aseptic techniques, so the patient may get a nosocomial infections while when you're giving suctioning, when you're doing suctioning for the patient, or when you're handling the patient. So what happens? There is a chance of getting infections. So when the infection comes, the patient may develop pneumonia. So when a patient develops pneumonia, that leads. So this antimicrobial or antibiotic like colistin will help in killing the microorganisms so that the patient condition can be improved. So the important things that the nurse has to understand or nurse has to look after is, so when you're giving a nebulization through the nebulizer, so you need to encourage the patient to inhale deeply and exhale slowly for 3 to 4 times at least. Why? Because, so when a patient is taking a deep inhalation, so it will help in taking the drug or the chemical that you're giving for the patient so that it will be displayed or it can be distributed equally for both the lungs. If the patient is having a deep inhalations continuously, that results in inappropriate absorption of the drugs. That's why always make sure the patient should take a deep inhalation and exhale slowly for 3 to 4 times during nebulization. The next is instruct patient not to talk during nebulization. It is very, very important because a conscious patients keep on talking while doing nebulization. So you have to instruct the patient not to talk during nebulization. Then as soon as you have done your nebulization, provide oral care. This is very important, and tell the patient not to split in the sputum cup, or you need to encourage the patient to have an oral care so that any flora or that will be removed from the oral cavity. Next, we'll look into this aerogen. So nebulization through aerogen. So aerogen is a method where we are using for a patients when they are connected with either invasive or non-invasive ventilator. So for example, if the patient is on HFNC and the patient is on NIV, so during this condition and the patient is on ventilator or intubator, then you can use this aerogen. So how you need to connect this aerogen? The first thing is, here you can see this is called as a solo, and this is a T connector. So you need to, so you need to connect this solo with the T connector. After connecting it, you need to add drug into the solo of this machine. Later on, after adding the drug, you need to on the machine by connecting the wire from the solo to the aerosol probe. So after connecting this, and this machine is ready for giving nebulization. So after that, you need to start the machine by start on and off button. So this is a power button where, so you need to select the timings, whether it is a 15 minutes or for 30 minutes. So 15 minutes means just you need to press the power button so that it will be coming as a 15 minutes, start it, and the complete nebulization will be done for 15 minutes. And if you are keeping a long press, so long press means it will be selected as 30 minutes. So if you want a prolonged or you need a increased timing for the nebulization, then you need to select the 30 minutes by pressing a long button in the power button. Next, if the patient is on ventilator, if you are using this, if you're using a nebulizer for a patients who are ventilator, then make sure you are removing the HM filter. Most of the nurses or the new nurses who are not able to understand this, and they are connecting the nebulizer with the HME filter. So what happens if you connect the nebulizer with HME filter? What happens? So you can give me the answer in the chat box. What happens if you are giving a nebulization through the ventilator, ventilator tubings with HME filter? Yes. So what happens here means, so the main function of the HME is to filter. So here, when you're giving the drug for the patient with the HME will attract all the drugs and the patient will not get adequate amount of drug. So in order to prevent that, make sure you need to remove the HME filter and then connect the nebulizer to the patient and start the nebulizer. Am I clear with this? Yes, thank you. Then coming to the inhalers, we have a different types of inhalers, that is metered dose inhaler, dry powder inhaler, rota inhaler, and spin inhaler. If you see these four types, the metered dose inhaler is different from these three, that is dry powder and rota inhaler and spin inhaler. Why? Because so metered dose inhaler will delivers the liquid mist into the lungs. Whereas dry powder inhalers, this maybe the machine or the equipment may be different, but the mechanism is same. So it will take the dry powder and it will be distributed based on the patient inhalation. That means patient has to pull the air with the mouth and press the inhaler. So when a patient is taking the inhalation, you need to advise and tell the patient to hold for 10 seconds after administering and then exhale slowly. So this will help in the distribution of drug for the patient. Next, so how the drug will be absorbed. So how it will administer. So when a patient is either using a metered dose inhaler or the rota inhaler, here when they are taking the medicine, the 5 to 20% will be absorbed into the lungs. And whereas the remaining 80% or 95% will be delivered into the GI tract. So this 5 to 10%, so after as soon as the lungs are absorbed the drug, it will be going into systematic circulation. So this systemic circulation is very important. And this drug that is gone into the GI tract will be absorbed into the liver and then it will distribute to the systemic circulation. So this happens. So what happens to the drug later? So this acts on the lungs. Later on, the drug that is delivered to the lungs will be excreted through the urine system and the GI tract. So it will be it will be excreted from the GI tract. So this is how the drug will be absorbed into the lungs and also the systemic circulations. Then next, we'll see the spacer. So this is a spacer. The main difference between the meta-dose inhaler and the spacer means if the patient is not able to press the meta-dose inhaler and the patient is not able to inhale through the mouth, then so this spacer will help in delivering slowly whatever the medicine that was puffed by the meta-dose inhaler. And this is most commonly used for the children. So there is a video so that I want to show you regarding how this MGI and dry powders and spacers are working. Can you see my screen?
Yes.
Yes, thank you. So this is dry powder inhalers. And when you're giving, so this is the port where a capsule is inserted into the rotahaler and it was twisted so that the lower part of the capsule will be dropped inside. And you educate the patients to take by keeping in the oral cavity and inhale extremely so that there will be a sound. So when a capsule is rotating, you will hear the sound. So that means the complete drug has been delivered inside the lungs. So this is how a dry powders will be functioning. This is a spacer. So here the inhaler is connected into the spacer and later on this is a mouthpiece. So where you are keeping this mouthpiece into the oral cavity of the patient and the patient will completely close the mouthpiece and inhale slowly. Next is meta-dose inhaler. So whenever you are using this, you need to shake before administration and tell the patient to take a deep inhalation from the nose and exhale through the oral cavity and take the medicine. And 2 puffs should be given, or according to the doctor's order, you need to explain the patient to take this. And slowly this drug will be delivered into the lungs, which helps in treating the underlying causes of any underlying causes of the respiratory disorders. And after that, don't forget to rinse the mouth with water and spit it out in the sputum cup. So am I clear with this video? So how different methods of devices are working in different ways? Then, so what is the difference between a nebulizer and inhaler? Is it same? So when you compare this nebulization with the nebulizer or any aerogen, then inhalers, it is totally different. So there is a minute, for example, so in nebulization, a fine liquid mist will be inhaled into the lungs from the patient to the patient, and inhaler, the patient itself has to push the drug and it will go into the lungs. The second one is for a nebulization, you always require a machine to convert the drug into the mist. Whereas inhalers, this is very small and handy. Whenever the patient feeling SOB or the patient is having congestion, immediately they can take it and they can use the inhalers. And the time period, which is very important, the nebulization requires around 15 to 20 minutes and inhalers requires only 60 seconds for absorption and quick relief. And so for nebulization, you need to explain the procedure to the patient and the patient has to cooperate with you. Whereas the inhalers, it is their own work to complete the inhalation. So this is the main difference between nebulization and inhalers. So what are the do's and don'ts? What you're supposed to do while inhalation therapy and what you should not do it. The first thing is Always remember, shake inhaler before the administration and explain the patient to inhale the drug slowly. Rinse the nebulizer chamber or dry powder inhaler under the running water. Provide sputum cup after every nebulization. Rinse mouth after administration. Whereas don'ts, you should not do it and it should be cautious. Do not swallow the water after administration. When you're giving water for the patient to gargling or to rinse the mouth, then you have to explain the patient not to swallow it. And avoid rapid inhalation as soon as you have given the drugs. And the third one is never use chemicals to clean the chambers or the nebulizer because it will cause nebulizer to damage. So that is why we should never use chemicals. So in conclusion, so there are as I explained you, there are numerous inhalation devices which helps to treat the patient with respiratory problems. And you can see this, none of this has proven that one over the superior and one over the other. But whichever devices you are using for the patient, the main goal of us is to remember that it always depends upon the technique of administration, how we are administering and how we are explaining to the patient and how the patient is using. And this is the important thing that you need to remember when you are going with inhalation therapy. So am I clear with the inhalation therapy? Any doubts? Any doubts?
Thank you, Yashna. You did an excellent presentation. I think our viewers are enjoying your session very well.
So we have a quiz, sir.
Huh?
Quiz.
Quiz, wait, let Madam overview, then we'll put the quiz.
Okay, sir.
Okay.
Thank you so much, sir.
Yeah, it's an excellent presentation. Hope our audience are enjoying the session. Please put your questions into the question remark. We'll answer on it. We'll get back to one by one. And this live webinar, as well as you can see anytime, we are available for 24/7 to answer some queries. Now, I would like to request our panel specialist, Mr. Sija Sanjay, to just overview us on the today's topic, this inhalation therapy and inhalation devices. Please take us now.
Thank you, Dr. Amar. Thanks for the wonderful session, Ms. Yojana. Myself, Sija Sanjay, GM Nursing for Hyderabad unit. So on top of this, I will just give an outline about the inhalation therapy. Inhalation therapy is vital for nurses to understand the various types of drugs and its action, do's and don'ts of therapy with different devices. The common conditions we use these inhalers in chronic asthma, chronic bronchitis, emphysema, and bronchiectasis. Nurses should bear in mind various devices and its usages like nebulizers, inhalers, and spacers. At the end, the teaching to the patient during discharge is very important. They get discharged from the hospital is where the nurses needs to demonstrate and teach them and ask them the demonstration with them to ensure the safe usage of inhalation devices. So my sincere advice to the nurses that we will have to teach the patient when they get discharged from the hospital how to use the nebulizer, how to use the inhalers, how to use the spacers, etc. at home. So thank you. Over to you, Dr. Amar.
Thank you, madam. As well said, patient education is very important because most of the devices used at the home, it could be for pediatric and geriatric cases or adult usage. If they don't use it properly, the effect of the medication and clinical would be delayed. So thank you so much, madam. Yojana, please put your questionnaires, please. We'll go through it. Just put few one by one.
Yes, sir.
Yeah.
Yes. Okay. So, which antibiotic is used to treat nosocomial pneumonia through nebulization? So, which antibiotic is used to treat nosocomial pneumonia through nebulization? So, options are there, and you need to select the right one. Yes, it is colistin D. So why we are using colistin? Because this is an antibiotic which helps in treating or killing the microorganisms when a patient has a pneumonia due to hospitalization. The next question, an asthmatic patient is admitted in your ward. and is not able to use inhaler due to weakness. Which device is preferred? An asthmatic patient is admitted in your ward and is not able to use inhalers due to weakness. Which device is preferred? So options: spinhaler, spacer, metadose inhaler, aerogel. Yes, it is spacer. So spacer will allows the patients to inhale slowly without having any disturbances for the patient, and there is no much effort done by the patient. The next question. So while administering nebulization for patient, what a nurse has to do? Instruct patient to inhale and exhale slowly, instruct not to talk, provide oral care, all of the above. Yes, it is D, all of the above. So it is the responsibility of a nurse during the nebulization or inhalation therapy, instruct them to inhale and exhale slowly and not to talk while giving nebulization and provide oral care. So these are the important things that you need to take home for a patients who are having inhalation therapy or nebulization. Thank you so much.
Thank you, Yojana. It was an excellent presentation. And we'll get back to interesting topics on the every Thursday, 3 p.m. Please log in. So excellent. Thank you, Mrs. Sija Sanjay and Yojana. Excellent presentation today. Thank you.
Thank you.